Hey, it's Laura Boozer, the Fascia Pro. I had a couple of athletes over the last few months that have had some really bad back challenges. One of them even stress fractures in their vertebrae, their lumbar spine. Not super uncommon. I actually myself, I blamed mine more on my weight and trying to push through being an endurance athlete after having babies and carrying a lot of extra body weight. But you know what? The body doesn't care. When it has stress to it, it's going to give and compromise however it needs to try to find and restore some sense of stability for you. But we're going to work on that today. So grab your foam roller. I need you to have a soft roller. If you have a hard roller, a lot of athletes, and I apologize, I was one of those people, we did a lot of foam rolling. Now, in my defense, we never encouraged you to press really hard on that. We always go on a scale of 1 to 10. Never should be over a 5, 6. To me, that 5, 6 range is it feels good in a sick, twisted sort of way, but you're not having to hold your breath through it. So if you don't have a soft foam roller, not a problem. You can go grab a yoga mat if you have one and roll it up. If you don't have that, you can just simply grab a beach towel, roll it, turn it, fold it in half, roll it up really tight, and we can use that as well. So things we're gonna do today. We'll spend about 20 minutes. We're going to do some rehydrate techniques to restore some fluid flow in our fascial connective tissue. Be great if you drink water, but that's not the hydration that we're talking about. We're restoring hydration, which is the intercellular fluid in what we call this 3D cellular matrix, this environment that our body lives in, the wrapping of everything. It gets dehydrated like a dried up sponge. We're gonna restore some hydration by some compression techniques. And then we'll add in a couple of neural reintegration patterns so that you can get a kickstart on reducing your back pain, but helping your brain reconnect to those deep core stabilizing muscles that are gonna help keep you out of back pain. So again, if you're an athlete, this stuff is going to make you perform at a level you never imagined because we don't realize how the compensating pattern of repetitive stress, whether you're an athlete or not, repetitive stress pattern is our brain doesn't ask us permission if it can compensate, if it can shrink down, get thick, get tight, impinge muscles, all the crazy, I can't even think of words right now because it's all so crazy, but to bulge our disc and herniate things, and no, it doesn't ask. It just adapts to whatever stress you put it on physically and emotionally. So let's make some changes in that. Go ahead, first and foremost, we are going to do an assessment because another lost art of Western world is we do not know what we sense in our body, and then sometimes even if we do, we don't know what to do about it. But let's check the common imbalance areas of where we tend to hold stuck stress so that you are aware of what signals your body is giving you. So laying straight down on the floor, arms extended, legs extended, palms down. You're just going to sense, not look or touch, sense what you feel in your body and give yourself permission to do that. All right, it's no judgment, it's an awareness. So think about your head weight. Where is it at? Is it tilted maybe a little left, a little right? Maybe your chin is lifted high off the ground. Ideally, where we want to see it live is right behind the brow or the bridge of the nose, centered in the middle of your head. Now we're going to go down into our shoulders. What do you feel there? Do you feel your shoulder weight really high? All the mass of your shoulder girdle is living high? Do you feel your shoulder blades punching into the ground because you're protracted forward? Ideally, where we want to live is the mass of our ribs heavily weighted low into the ground, so the lower part of the ribs. And then how about your arm masses? Are they even from the right to the left? And then moving into our low back, do you have a real hard tensional pull right now in your spine, in your back, causing you to have a lift all the way from the ribs all the way down to your sacrum? Ideally, here's one area you can touch. Go ahead and put your finger in your belly button, and where we would like to see this tensional pull be is very slight and a small curve from the belly button down to the pubic bone. So just make a mental check of that. Then let's go into our hips. So if we have a big common imbalance, obviously, is in our pelvis and our pelvic girdle or our hips. So where's your weight of your hips? Is it in the glutes, in the flesh of the butt cheeks? Or is it heavily weighted in the flat bone, your sacrum and your tailbone? Now let's go to the back of the thighs. Are they even on both sides? Maybe yours are not even touching at all, but the masses should be evenly weighted from the right to the left. And then what about the space behind your knees? Is it even, however lifted it is it even from the right to the left? Calf masses, same thing. Where are they? How even are they from right to left? And then let's just do a mental check. Don't visually look, but a mental check of where your feet are right now. Where we'd like to see them be is just slightly tilted evenly right and left, making like the letter V. You might feel that one foot is pointed away from you, plantar flex really hard to the wall in front of you. Maybe you feel that both your feet are turned towards your midline. But again, don't look. This is just a visual or a mental assessment here. It's a body sense. We're sensing what our body, we're getting in touch with our body. Now divide yourself in a right and a left half, and from your ear all the way down to your foot, all of those masses we just named off. Do you feel more even in all of those masses from right to left, or are you more heavily weighted on one side than the other? Great, now you know how dysfunctional you may feel right now, but we're going to clean that up. Let's go ahead and turn to our side. And if you know what the reconnect sequence is and rebalance, I would encourage you to do that where you're laying on the roller and you go through the gentle rocking, you go through pelvic tuck and tilt, and you go through our 3D breathing techniques. That is always an amazing one to do either before or after. Sometimes I find that doing it after gets me more back into connection when we reassess at the end. But if you know that technique, try that. If you don't, it's on another video. So make sure you like, subscribe, follow, and go to the reconnect sequence that we have. Okay, so let's start with some hydration. Grab your roller. We're gonna sit on our hips. And the first thing I want you to do is actually, I want you to find your sits bones, your tailbones, your ischial tuberosities, right? So we're gonna sit on it and then put your hands in front, always trying to maintain a sense of core stability, right? So I like to pull in, lift up a little bit, feel engaged in your core. And then I want you just to gently push from your feet, go back and forth to where you can find your tailbones, find your sits bones. And this is where all of your hamstrings attach. At the bottom part, when you're shifting your weight back, you're actually touching where your hamstrings attach. As we move around to the edge, if you shift your weight to the right and glide around, so gliding, we're rocking back and forth. The roller's moving a little. You're gonna get to where your deep lateral rotators are, where they're attached. So we're gonna glide around there. And so gliding is a preparatory technique. And I'm gonna scoot back so you can make sure you can see my feet. They're just down on the ground. And modify however you need to get your glides and your shears in. But we're gonna stay close to the sits bones. So shift your weight to the left and let's move around. So I'm actually envisioning this hard mass, this ball of a structure. And coming off of it are all these different muscle tissues, this connective tissue. We'll call them ligaments, call them fascia, whatever you want to call it, same thing, essentially. So we're gliding back and forth and assessing, but while you're assessing to see what you feel as far as tenderness, you're also prepping, it's preparatory for your soft tissue. Okay, now we're going to shear. So you can shift your weight to one side if you want to bend the other leg a little more. Go ahead and do that. I'll even put my hand here. So the goal is to shear by pressing a little more firm. We're working deeper. This is a layer deeper. And we're pinning the flesh, and I'm moving my body, my structure, my bone, back and forth over the flesh. So you see the roller isn't moving when we're shearing. This is where the magic starts happening. This is where the hydration is actually happening. You know, over 20 years of being a massage therapist, we talk about deep tissue massage. And I hate to admit this, but I probably should send apology letters to the first couple of years of people because I thought deep tissue massage was how hard could I dig in. We're trying to engage the fascial tissue by pinning it and moving it around. And on my arm, you can see this. This is gliding, and this is engaging fascia. So I'm not slipping around on the skin. I'm moving the structure. So you can kind of think of gently massaging the tissue from the inside by the bone. Now we can indirectly shear by moving the bone. I'm going to drop the leg down, bring it back up, drop the leg down, bring it back up, and then we're going to compress and wait. This is where I envision a big sponge squeezing down in the water. It's hydrated, but we squeezed it. We're gonna let it go, and it absorbs more fluid. All right, let's glide to our other side. Now, in the world of sports, I'm gonna turn so you can see me. We, for a long time, if I went today to a training room, I would see the same thing. There's PVC pipes sitting around. They take the barbell and they start digging in with it. And because as athletes, yeah, it's got to be more is better, right? If it doesn't hurt, it doesn't help. This is restoring, this is recovering. So we have to understand the difference, just like when you're training. Now, keep gliding for me here and exploring. Just like when you're training, there's specific things you're doing for a specific outcome. We're recovering, so we're not trying to get in there and dig it out. We're trying to restore hydration, restore connection to the brain, recover the tissue so that you can then recover faster and perform better. All right, now we're gonna pin the flesh and we're gonna shear. So several ways to shear. You can sit and pin the flesh and move your body just side to side. Now remember, we're staying up tall, we're staying up high to get into the deep hip. We're not going to the side and getting into where our piriformis and a lot of the neurology is coming through. That would aggravate it. So again, keep thinking that you're shearing and moving around the head of that bone. All right, so I'm pinning the flesh, I'm making little circles. As I said, we can shear back and forth. You can log roll, just shift your whole weight because you might be popping over things. And we don't pin the knot. Ugh. It's so hard to get out of that mindset if you've been a foam roller your whole life, all right? And you're going to find that you'll love this. The outcome, go ahead and drop the knee, indirectly shear. The outcome of changing your mindset to restorative and making long-term changes, reconnecting the nervous system, you'll be amazed at like, wow, that's all I have to do. This doesn't even hurt. It actually kind of feels good. Yeah, it's what gave me my life back, and I'm able to train and do triathlons again. All right, now stop the indirect shear, compress and wait. Nice focused belly breath. Really connect when we say a focused belly breath. That's why we call it a focused one. Make sure you're engaging and breathing from your diaphragm. Now let's come back to center, and we're gonna glide back. And I'm gonna have you now glide to the high hip. So what do I mean by high hip? High hip, we were working down here. So in a seated position, we're underneath all of this area. Now we're gonna work high. Here is my hip bones. My hip bones are all the way up here. So we've got from this area all the way down here, which looks like this. It's an optical illusion when you're in a seated position of where these areas are. Here's where we were, here's where we're gonna be, right? We're not gonna stop in the middle because that's where piriformis, the sciatic nerve actually gets. So we can work indirect to direct, right? We can work up here and affect down there. So now we're going to adjust our feet again. We're gonna shift our weight to one side or the other. I'm on my left side, and I'm gonna start rolling up and down, gliding, exploring, see what you feel. I encourage you not to glide in the same exact spot every time. You can drop down to your forearm or your elbow. Again, I'm bending the back leg, so I'm using it as my leverage to move. This leg is just relaxed as it can be. And I'm gliding up and down, exploring tissue and preparing, that's right, preparing the superficial layer. Back up, you can see me. And now we're gonna shear. So several ways to shear. Again, directly shear, we can shift our weight back and forth. We can make little circles. You can log roll if it's really tender. Again, if you're popping over things, don't try to pin it. Go on over it, nuzzle up next to it, and then we can indirectly shear by dropping the knee down to the ground, bringing it back up. Nice focused breath when you drop it down and hold it. And then we can glide over to the next area. Now, obviously you can spend more time here if you want to get into another area on the side hip, of course you can, but we're gonna go to the other side for time purposes. I'm gonna shift back around so you can see, get a little different angle. So again, here's where we were, here's where we started. Come on down. Now we're lower. Lower meaning, here's my hip. We've got all of that area. Now, not up here on the waist, that's the waist. Find your waist if you need to do that, come to the bone, and then just go just distal, just on the other side of it. Okay, so here we go, we're gliding. Up and down, turn a little. Up and down, turn a little. I'm using this back leg as my leverage to hold on to. Up and down, turn a little. We're exploring, we're preparing. The brain is recognizing that you've got a nice, gentle, smooth touch. So it starts bringing hydration. Now it's gonna let us get a little deeper. So now we're gonna start our shear. So pin the flesh, move back and forth. You can make little circles. Pin in the flesh. So the roller is not really moving, you are, but we're not digging it out. We're not getting in there and getting it. We're not working hard for a good outcome. We're recovering, we're restoring, we're causing hydration. So when you get that fascial tissue engaged and you go to its endpoint, like I can't go any further right there, I'm stuck. The fascia is at its endpoint. Magical stuff is happening right now. Hydration, this hyaluronic acid is just secreting out, allowing all of the cells to absorb nutrition, to relax, recover, restore, and allow you to go have the best run you've ever had or sit without pain. Works the same. What language do you want to speak it in? If I'm talking to you and you're a professional athlete, we can restore and recover you so much faster this way. So we're indirectly shearing right now. Drop the leg rather. If you're a normal person that just wants to live without pain and be able to do whatever you want, have a better quality of life, this is it. Take a nice deep focused breath. All right, we've hydrated our hips. Now I'm gonna have you sit up, move the roller down underneath your knees. We're gonna lay back and we're gonna go into some low back hydration. So move a little closer so you can see. So here's where we're at. Got on high yoga pants. So here's my hip bones. And right now, I'm not in the right area. If I were to bring my hands around, I'm hitting the top of the roller. And actually, I don't know if you can tell from the video or not, but my pelvis is kind of tilting also. That's not what we're wanting to do. We want the roller to be in the center of our pelvis. Now we gotta check the other end. I think I'm in the center, but let's check. If I were to bring my knees up, which we're going to do some work, I don't feel like the roller is pushing out away from me. So make sure you check that. And again, I'll turn a little bit. Okay, so the roller is in the center of my pelvis, right? So just kind of move back and forth for a second. I can tuck and tilt. Yep, nothing's moving. I'm not too high. Great. Okay, now the first thing we're gonna do is just do a little bit of a twist. And main thing to keep in mind while we are doing all of these techniques is being aware, being in touch with your body to know what is not supposed to move. Because a compensation pattern that happens is your brain likes to cheat. If it doesn't have it available to do whatever it is you're trying to do, it compensates without your permission and it allows you to cheat. But that's what causes us pain and problems long term. So let's be very body aware, keep a core engagement. If I were to punch you in the gut, you would connect down. So as opposed to sucking up, we're connecting down. It's like the pubic bone almost comes towards the ribs. So I call it lock and load. Lock and load your ribs down and keep those nice and stable, right? We never want them punching up. We want them to stay heavy and down, all right? So we're gonna start with just a little bit of hydration in our flat bone, the sacrum. Just a little bit of a twist back and forth, but let's stay stable and heavy. Ribs are heavy. And then we're gonna shift our weight to the right. So the first thing I want you to do is just march in place. So this isn't gonna be this like, wow, I really feel that kind of thing. If you're getting to that, you're moving too much. We're getting just a gentle movement of the right ilium, right? The right side of our pelvis. SI joint, our sacroiliac joint, is getting some hydration. Now we're gonna stop that movement and we're gonna keep our ribs heavy, don't let the upper body move, and we're gonna make nice little circles with our knee. If you feel popping, clicking, clunking, any noise, just make your circle smaller. And again, pay attention to what your upper body's doing, stay in control of it. And envision the head of this femur bone is just massaging the inside of that joint capsule. I've had labral repair in both of my hips. I can't do this one enough. It feels so good.
And if you're not really feeling a whole lot, just know there's so much good that's being done inside because you're shearing and translating tissue, fascial tissue against fascial tissue in the joint. So we're getting good synovial fluid, getting good hydration in the joint capsule. Now we're going to the other side. So just march your legs to the other side. So you're not moving so far over, you're on the flesh of the butt cheek. You're still on the tip of the sacrum because our focus is the other SI joint. So we're gonna keep this leg stable. The outside leg, the one that you're leaning on, is the one that we're going to now make our circles with. So lead with your knee. Just make a big full range of motion circle. Pay attention again to your core. What's happening up here in your ribs, keep them heavy. We're not cheating or compensating. We're just hydrating. Popping, clunking, clicking. Just make the circle smaller. And then we're gonna bring it back to center. Okay, now we're going into our tuck and tilt challenge, okay? So just to play with the tuck and tilt first. If you tuck your pelvis up or curl your pubic bone towards your nose, that's the tuck position. The roller should not push out behind you. And then tilting is more setting or pushing the pelvis on top of the roller. You're not trying to arch and be on the other side of the roller with this tilt action. Again, we have to pay attention to keeping the ribs heavy. We don't want them moving. If you feel the ribs go up, you're letting your brain, you're letting your body cheat, okay? So let's take our hands, put them on our thighs. We're gonna run them up to the top of our knees. Big thing you're gonna focus on here in just a moment when we contract and we activate our thighs into our palms is not letting your feet kick out. If your feet kick out, reset, start over. That's your quads trying to fire. What we're actually trying to fire is one of the deep core stabilizer, one of my favorite muscles in the body called your psoas, P-S-O-A-S. So we're wanting that one to fire, not anything else. So let's put our hands out in front of us. Let's take a nice focused deep breath in. Ribs stay engaged, and you're gonna exhale and contract, fire your thighs into your palms, but be mindful, don't let those feet kick up. Now, also, we're trying to pay attention to our pelvis. Did it suddenly flatten out or tilt away from us? Let's keep it neutral and engaged. So check it if you're not sure. It's the first time you've ever done this, let's make sure. We don't want our brain to compensate. All right, and then inhale here, exhale, and relax. Okay, that's an important part, is being aware, being in touch with what you're doing. What's that pelvis doing when you fire those legs? Now let's get our action going. So inhale, exhale, and fire those knees into the palms. So 50% pressure pushing from my knees. Pay attention to the pelvis. All right, let's go again. Inhale and tuck. Exhale and tilt. Just let the pelvis or the sacrum be heavy on the roller. Inhale and tuck. Keeping those knees fired into the palms. Exhale and tilt. And relax. Take the right hand, take it over to the left hand. Contract or fire on the inhale, this thigh into the palm. Inhale and activate that quad. Watch, don't let that foot kick up. Exhale and drop the right foot towards the ground. Keep the pelvis in that neutral position. Don't let it tilt away. Inhale right here. Exhale, and slowly with your exhale, the same timing, bring the knee back up while you're keeping the other one active. Great. Switch hands. Right hand to right knee, left hand to left hand, left hand to left hand, left hand to right hand. Inhale for me. Fire this quad, and then drop the left foot down. Don't let it touch the ground. Keep this active, contracting, and watch that pelvis. Don't let it tilt away from you. Inhale again. Exhale, bring that leg back up. Make sure you're active here. Fire that right thigh into the right hand. Switch hands, let's go again. Inhale, contract that thigh into the palm, and exhale and lower that foot back down. Keep that tilt, don't let your pelvis go out away from you. Just because the leg's moving away, don't let the pelvis tilt. Inhale again. Exhale and bring that back up slowly with your exhale. Match the speed of movement with the breath. All right, now we are going to level that up a little bit. We're going to inhale, activate that thigh, drop the right foot down on the exhale. Inhale again, This time we're gonna straighten the leg. Now when you straighten the leg with the exhale, don't let that pelvis go flat on the roller. Keep the left leg firing into the palm. Inhale again. Exhale and bring it back in. Great job. If that's too hard, keep with it just going straight down. All right, right thigh, right hand, left hand comes over top. Inhale and make this thigh active. Exhale and drop the foot down to the left leg. Drop that foot down towards the ground, not on the ground. Check the pelvis, check your ribs. Don't let them be off the ground. Inhale again. Exhale and straighten that leg. Let's check everything. The right thigh is firing into the palm. Don't let the pelvis be going away from you. Relax this foot. Inhale again. Exhale and bring it all back together. That will help your low back about as much as anything. That's my go-to for everything. Now, put your feet on the ground, lift your hips, move your roller out of the way, and let's rehydrate the inner thigh. Favorite way to get this set up right is to grab the end of the roller, set it out in front of you. We're gonna lay our body down. So our head, our shoulders, our hips, and our ankles are in alignment. And your roller again is outreached in front of you. So the top of the roller is away from your head. The bottom of the roller is just the length of your arms. And again, I have to back up for you to see. All right, so here we go. We're gonna take the bottom leg, straighten it out. Top leg, we're gonna roll the roller back to us. It's gonna be in 90 degrees. So check your alignment. You're long and straight here. Relax down to the ground. This is everything about what we do with Melt and this fascial rehydration is about the setup. If you don't get the setup right, you're gonna let your brain compensate, and that's what we're trying to undo. So make sure that you're nice and long, you're not rounded forward. I see that a lot, especially with my athletes. We kind of round forward like it's gonna help. And I want the crease of the knee, the fold of the knee to be right on the roller. So you're at 90 degrees. So let the foot hang down. It's not up here, it's not on the roller. So set up, get that good. All right, now here we go. We're going to rock all of our masses out. So the leg is just gliding, and then we're gonna scoop by actively pushing the thigh into the roller, back in. Here we go again. Let it glide out just a little bit. Scoop by pushing the knee heavy into the roller and bring it back in. Let the foot stay heavy on the ground. Glide back out and scoop back in. One of the challenges I see a lot is people lifting their leg while they're doing it. We're trying to relax the muscle tissue so we can engage the fascia. One last time. Let's glide out and then scoop back in. So there's our glide. We just explored, found some tender stuff. Now let's shear. We can go up on our toes and we can shift, pin the flesh, be a little active by pushing the thigh down into the roller, and we're pinning the flesh and moving the bone up and down. You can make little circular motions if you want. And then we can indirectly shear by letting the leg lay heavy and straightening the leg and bending it. Straighten the leg and bend it. We can then, this is my favorite, keep it in 90 degrees and slowly lift the foot and back down. And then lift the foot and back down. Glide 3 times. Direct shear 3 times. Indirect shear 3 times. You don't have to do more than that. You can if you like, but it's not necessary. Now we're gonna move up a little higher. So again, all 3 of our masses are rocking. We're not just moving our hips and leaving our shoulders here. So glide out, now we're towards the middle of the thigh, and glide back in. And remember, we don't glide in the same spot every time, so you're shifting the weight maybe a little more to the front where vastus medialis is, or one of your internal quads. You see me kind of lifting my foot up a little bit. And we're gonna go one more, glide out, and then compress a little bit and push back in, scoop it back in. Now we glide, we go to a shear. So you can put your foot down, you can pin the flesh, you can shift the leg, so you'll just see my femur bone is going up and down. You can make, again, little circles. We can indirectly shear by extending the leg and bringing it back in. Please, big thing here, just be heavy on the roller. Don't contract and fire. If you contract and fire your legs, it pops you up off the roller. We want to be heavy on the roller and let it sink and melt into the roller. And then let's go to 90 degrees and then slowly and carefully lift the foot up like you're trying to put a footprint to the ceiling. If you've been doing this for a while, I'm gonna encourage you again to be more precise, and the preciseness is slowing down your actions and going in smaller areas. So I like to use the analogy of when I'm giving a body work, giving a massage, if I glide down your back, the last thing you want me to do is go up and down with my pressure.
We want to be nice and fluid and consistent. Fascial likes that. Compress and wait, nice focused breath. Now, can you go higher? Yes, you can go all the way. You don't have to move the roller, actually, all the way to the attachment. If you do this, I want you to move your body and be more in a prone or face down position. And you don't have room to glide. We don't need to do a booty shake to glide. Let's just do a little passive shearing. So meaning we're moving while we're shearing. So we can drag the knee up and down. Make little baby circles. This can be a very, very tender area. You can straighten the leg and then bend it. Straighten the leg and bend it, and then compress and wait. Nice focused breath. Great. Now we're going to come back to our side. We're going to switch legs and do it again on the other side. I typically do not go all the way up to the attachment. I'll stay lower and do the middle to the upper thigh. I don't usually do the top, but you most certainly can. All right, let's go. Start with our long body. The roller is going to just be away from you. So the head of the roller, I'm looking at the end, kind of lined up off of my chin. The bottom of the roller is going more towards the angle of my knees. I'm bringing this top leg up at 90 degrees, dropping the knee down. Let the foot be on the ground. The setup is key. Please make sure your setup is right. Now we're going to rock all of our masses out, not just our hips, and then scoop it back in. So let your body fall forward and scoop it back in. We're keeping our square here, our hip bones to our shoulders, making a nice even square. So roll the whole body and scoop back in. There's 3 glides. I'm gonna go one more and get a little bit more to the top so you can directionally kind of turn. Now we're gonna shear. So we can again shear by shifting our weight, pinning the flesh into the roller. You can make little circles. This is a nice place. This area is a high concentration of congestion. Just a wonderful area to work on. You've got all of your adductor muscles, adductor mangus, sartorius. You've got some different attachments, vastus medialis, a lot of lymph nodes in this area, just a lot of neurology, vascularity, and congestion that we're trying to open up and hydrate. All right, and then we can extend the leg and then straighten and bend. Extend it out and then bend it back in. And then relax the leg down. Remember, we're trying to be heavy on the roller. Now we can indirectly raise the foot up and drop it back down. Raise the foot up and drop it back down. And again, if you've been doing this for a while, I'm going to encourage you to go slower and smaller with your actions. You'll feel like you're pressing harder, but you're not. That's you respecting your fascial tissue, and the brain is allowing you to get deeper. All right, here we go again. We're going to the middle of the thigh. So rolling out and then back in, and rolling out and back in. We're working more towards the middle of the thigh. And you've got some different variations. You can go on and bring the leg higher if you want. You can keep the angle of the thigh lower if you want and be more on the vastus medialis, a little bit more on the inside of where your quads are. So that is for you to explore. And now we're going to shear, pin the flesh. I'll put my foot down on the ground and I'm just shifting the bone back and forth. So again, it's like my bone is massaging the inside of the flesh, causing a translation or hydration of the tissue. Again, that's where all the magic happens when we go to that end point of the flesh. Now we're going to straighten the leg and back in. For years, I took classes that are called active release techniques, some amazing work that we do hands-on. You're actually doing a very similar thing when you're doing shearing and gliding. Okay, now we're gonna raise the leg up. But one of the things that we'd always say in ART is the last 10% is 90% of the fix. So raise it up and back down. So to get the last 10% as far as depth is you going slow and even and consistent with your pressure and your action. Great. Now compress and wait, nice focused breath. And back down. Okay, now let's go and do, we'll do 2 different neural reintegrations. So meaning firing the glutes. So the first thing we're gonna do on this one is we're going to extend So let's do a neural reintegration pattern here. We're gonna do the clamshell. I think that'll be a good one to start with today. Let's do clamshell, because I've shown some other ones in the past on videos. So the first thing that we're gonna do, we're gonna lay down on our side. Use your roller as a head pillow, as a rest. It's the only thing I'm gonna tell you that's gonna be easy to do. And lift your hips up and shift your weight back so you're not on the hip bone itself. We're gonna put our heels together and knees together. Nice fetal position here. We're going to try to engage the core. We're gonna shift the hips away. So we go through, I love the terminology that Sue uses in the melt method, is we're gonna tilt, we're gonna stack, and we're gonna row, okay? So in our clamshell pose, in order to turn off or pay attention to what is gonna fire automatically for you, which is never the right pathway, we have to have some cueing words, okay? So tilt, what I mean by is just add a little bit of tilt of the pelvis, so the booty's kind of going back a little bit. And then the stack is taking the hip bones, because right now, if I put my hand above my hip bone and I'm just relaxed, this hip bone raises higher towards my head, and the one on the ground is staying put. So right now, this hip bone's here, this hip bone is an inch further down. We want to stack our hips to where if I stood up right now, I would be even, right? But when you stack the hips, we're not letting the ribs come off the floor. So just a slight little tunnel right there where the waist comes off, the waistline comes off. All right, now the other part of the setup to avoid compensating and allow this to be just an action from the femur bone and just this small little action engagement of the deep hip stabilizers is this hip bone, this pelvis is not going to move. And the way we help this is by trying to intentionally lengthen the knee or activate it in front of you. You'll see and kind of feel how it pulls the pelvis and rolls you a little forward. That's the intention. And we're gonna then pin our heels together when we raise up. So let's do it. A little tilt, a little activation. So gets you a little bit of a stack. And then we're going to raise the leg up by compressing our heels together. So I would recommend that you try to envision that the pressing of the heels together is what allows the leg to raise. Because in the old world of we call it Jane Fonda, I don't know if I'm telling my age here, we would do clamshells all day long with a TheraBand. Like I had to put a TheraBand around my legs just to feel it. But what we were doing was cheating. We were compensating. We were opening up our leg, and when you do that, the hip actually moves. That's the brain compensating, using bigger muscles to help. That's not what we're trying to do. We're trying to activate the deep, deep hip stabilizing muscle. So here we go again. Let's go through the whole sequence now. Little tilt, activate the knee forward, push through the heels, and we're gonna raise it up. Don't let the hips move. And back down, very small movement. If you're moving big, you're cheating. It's not your fault, the brain's just allowing you to do that. And the other thing we're gonna do is lighten the underneath leg, the leg on the ground. It's not like you can raise it, but it's a thought. Try to not push it into the ground. I've had people before like, I don't know if I'm doing it right. If you want to push the lower leg, push the toes into the ground while you're activating your heels, that might help. But you shouldn't have any problem feeling this deep into the thigh. Now, if you're feeling a different path, the weird stuff going other places, reset again and start over. All right, one more time. Let's keep it open and hold it right here. Lighten the lower leg. It's an idea, right? It's more of a thought. And now let's pulse up. Baby pulses up, lift, lift. Now keep trying to keep that knee active out in front of you. Yeah, feel how that changes when you put that intention into lengthening that thigh up. So yes, we are raising it, but I'm thinking of going out and up, out and up. Nothing here is moving. And then up and hold. Now let's take it all the way back down. Don't rest. All the way back up. All the way back down. We are neurologically reintegrating a pattern to your deep hip stabilizers. It's a lot of words, but you're gonna feel so much different when you stand up. Great, if you feel the burn here, great job, you did it. Let's sit up, push yourself to the other side. Whoa! Feel like you need a shear right now on that area, doesn't it? Right.
most people have never really felt that type of pressure or that, I don't want to call it a tightness, but the contraction before. Let me lay back. Okay, let's get our setup again. Our bottom arm is just outreach. Don't be on the shoulder itself, just a little bit on the shoulder blade. Our head, our shoulders, and our hips, ankles are all in a straight alignment. We're gonna press our heels together. We're gonna activate our core. We're gonna stack our hips, but the easiest way to make that happen is to activate that knee just a little bit out in front of you. Okay, here we go. By pressing the heels together, lengthen the knee and raise it up. And back down. Raise it up. You're compressing your heels together. Keep the knee activated out in front of you. Nothing here moves. Nothing in your core moves, in the center of your body moves. So if you are making a big open clam, you're letting your brain cheat and compensate. That's what got you in pain. So let's reset that. And how the reset goes, a little bit of a tilt, a little lengthen with the knee. Let this one be over the end of the other one. Press the heels together and raise it up. Now, if you're pressing hard into the ground with this right knee, the one on the ground, lighten it up. It's more, again, a thought. You can't actually lift it up. That would be almost impossible right now. Stay nice and steady. We're still raising and lowering, and lift and hold. All right, check everything here. Little tilt, press the heels together. The pressure of the heels together is a powerful part of this, and then lengthen. So the intention is to lengthen this top knee away. Little pulse at the top. Here we go. Here's 8, 7. Don't let anything else move. 4, 3, 2. Up and hold. You might be noticing, like I am, a little shake. This is maybe my weaker side, but it is reintegrating big time right now. A little shake, shake, shake. Don't let the body compensate. Keep everything in its position. Little tilt. Keep lengthening that knee away. And then let's go all the way back down. Don't touch it. All the way back up. Whoa. Here I go, making up songs again. I like to sing when I feel stuff, when I'm becoming more in touch with my body. And one last time, all the way up and all the way down.
Congratulations, you have just turned your butt back on. Oh, now, obviously you can rehydrate, you can go through another reconnect sequence, you can shear a little more here if you like, but I am so happy for you that you're well on your way now to understanding your body a little better and getting yourself out of pain. So thank you for tuning in. Be sure and subscribe to this channel, share it with your friends, and continue to check back as I'm going to continue to post little classes and little helpful hints to restore your body back to health and function to give you a better quality of life. Have a great day, gang. See you soon.